Ladies and gentlemen, good morning and a very warm welcome from Pakistan. Let me begin by congratulating the global cardiovascular disease community for having convened at this important occasion and for coming together in solidarity for a very important mission. I want to congratulate in particular the President, the past President, and the incoming President of the World Heart Federation. My friends Salim Yusuf, Srinath, and David Wood, let me tell you that your efforts to promote the cause of CVD prevention worldwide are greatly appreciated. And I also want to tell you that you are very fortunate to have as your CEO, Johanna Ralston, whose commitment and energy I greatly admire. I'm sure many of you know that the World Heart Federation is very close to my heart. I've had the privilege of serving on its board, and I have been honored as chair of its Foundation Advisory Board. As chair, I learned from the amazing teams as they planned and executed year after year the internationally acclaimed World Heart Day and the global Go Red for Women campaigns. Also, during the years when I practiced as a cardiologist, it was my good fortune to be a small part of the global CVD community which fought and campaigned to place CVDs higher on the global agenda. I'm sure many of you in the room recall the struggles we had, the disappointments we endured, and the ray of hope that the 2011 political declaration on NCDs brought to our community. As a group, we have been very blessed that our important agenda, our mission is now squarely embedded in the Agenda 2030 aspirations. In fact, if you cut across the Sustainable Development Goals paradigm, you will appreciate that many of its elements offer structure for CVD prevention and control. And here I'm referring in particular to its focus on systems for delivery, its emphasis on universal health coverage as an endpoint, and sustainability and partnerships, and the importance it accords to multi-sectoral action. All of these offer important elements which are crucial for CVD prevention and control in any setting. I'm sure you must have noticed that Agenda 2030 is universal as it should be. Today, 700 million people face hunger on the one hand, but on the other hand, 2 billion people are also overweight and obese. A quarter of the world's population is infested by worms, but half of the adults suffer from CVD and diabetes. For a large segment of the world's population, poor quality water, sanitation, and housing conditions act as disease determinants, but for an equally large segment, improper urbanization, energy-dense and nutrient-poor foods, sedentariness, and tobacco use act as threats. For us, the bottom line is clear. Cardiovascular disease is the #1 cause of death globally, and there's every justification to prioritize action to curb it. Ladies and gentlemen, I would like to draw an analogy here and say that the CVD and the broader NCD community is in a much better position compared to the HIV/AIDS movement if we compare our trajectory with them, because we are ahead of the curve when it comes to action, and particularly knowledge and evidence. We have the knowledge and the evidence to curb this problem. We only need the will to act. We know how to prevent CVDs. We know how to avert premature death and disability. We have knowledge about the changes that need to be brought about to reconfigure health systems. We know about the salient role of intersectoral action. We have all the evidence, but we now need to put this into implementation. And it is here that locally relevant policy and regulatory measures are the key. We must step up our capacity to implement. Ladies and gentlemen, it would be critical for various stakeholders to play their role in this effort and for us to draw on comparative advantage. WHO is there to provide normative guidance and technical support. Professional associations have the ability to rally the professional community. Governments have the mandate to frame and implement policies, laws, and regulations, and the private sector has to be on board to implement policy. I'm sure all the constituencies must be present in the room, and really your coming together is a sign of progress. I also cannot help recalling that this meeting is being held in Mexico, and I want to pay rich tribute to the leadership of Latin America, particularly in the areas of tobacco control and secondary prevention. Mexico in particular has been a trailblazer in terms of putting in place bold fiscal and regulatory measures. And with my Ending Childhood Obesity Commission hat on, let me tell you that we so admire that. Let me also take this opportunity to congratulate the Honorable Minister of Health of Mexico for his leadership in this area. And I also want to thank the Honorable President of Uruguay for his personal commitment and for the support he's lending to this meeting. The global CVD community is just in the right geographic spot to draw inspiration for the meeting that lies ahead of you. And I want to take this opportunity to wish you the very best. May your deliberations leave a lasting mark.